When we think about dosing, we're thinking about several different things. We're thinking about the route of administration. Just in the last week, we've had to administer herbs rectally for a patient that's in critical care. But you might be applying them topically, you might be using inhalation therapy, you might be giving them orally as a tea or a tincture or a capsule. So you need to know a little bit about the product form or the herb form that you're using, frequency of dosing, what the bioavailability of the constituents are or the herb is. Now, a lot of herbal constituents are actually relatively poorly bioavailable, and there are ways and means of increasing that bioavailability as well. We also have to think about our patient, the age and condition of the patient, whether their gut's in good condition, whether they can tolerate particular herbs. And there's also some issues around idiosyncrasy as well. I've had one or two patients over the years that respond to ultra low doses, really, really small doses, and if we try and push the doses up, they get diarrhea, for example. And so some animals just seem to be more sensitive. It probably has something to do with their microbiome. There's quite a bit of research on the influence of herbs on the microbiota and how some of these really poorly bioavailable constituents in plants act like prodrugs. And once they are metabolized by the microbiota, they then, their bioavailability can increase. And this is just a reminder about the importance of knowing the product that you're using and what its concentration is. So which one has more? 5 mils of a 1:5 liquid extract, 2 mils of a 1:2, 1 mil of a 1:1, or 200 milligrams of a 5:1 spray dried extract. Now this is a really important concept to get across and something that you need to grasp if you're going to be using herbal products like these herbal extracts or capsules or any other sort of mode of herbal remedy. And the reason for that is it's only when you understand how to interpret this that you can actually come up with a milligram dose and a good way of comparing, say, published research or information on herbs and herb dosing with the product that you're actually using. You need to be able to sort of correlate them, and we'll show you how to do that. Here's our patient. When you're starting out, start with small doses. We'll define what we mean by small shortly. Think about the vitality of your patient. That's something that we learned about. One of the principles. If you've got a really robust patient, you can be a little bit more, have a slightly higher dose than a patient that's very debilitated. And I probably wouldn't recommend you start with fragile patients, although it's very, very tempting when you're a beginner herbalist. You suddenly think of all these cases that you'd like to try them on. But, my advice is if you're dealing with fragile patients already on polypharmacy, etc., is that you either undertake further studies or you get a really good grip on the monographs of the herbs that you want to use so that you can minimise risk and safety issues with those patients, and also maximise efficacy as well. So either refer to a veterinary herbalist or get in touch and get that support. The patient is one of your key factors, and then the route of administration, and then you need to think about the length of treatment as well. So those things all come into play when we're talking about dosing. People will say, what's the dose of this particular herb? And it's kind of this, but it depends on these factors. So it's not a straight answer, unfortunately, although, again, we can give you guidelines. So the client also comes into this as well. If you want compliance, we need to make it easy to administer the herbs. And I really like using tinctures in my practice, although I use tablets and dried herbs as well, and oils and other things. But tinctures are great because, one, I can individualise my formulas for a particular patient. And then the other thing is they can be added to food very easily. They are not added to dry food very easily. Canned food, yes. Fresh homemade food, or some of the commercial products that are dehydrated and then rehydrated. Some of those bath diets and things like that, very easy to add herbs to. We're talking about small doses, 1 to 5 mils, for example. That's less, a teaspoon. So small amounts can be diluted with a big bowl of food. quite easily. With cats, you can add it to food, particularly canned food and sometimes fresh food. And again, you've got to go very, very slowly. Start off with diluted tincture, then adding a drop here, increasing it to 2 drops, increasing it to 3 drops till you get to your dose over a period of time is one way of doing it. And also getting rid of alcohol out of your tincture is another trick to getting cats to tolerate herbal tinctures.